healthcare reform really hasn't been on the front burner for the past few months. It's all we talked about for a long time, but you know, the debate is over, and now we're waiting for it to trickle in. Well, guess what? Even though most of the reforms don't go into effect for many years, some of them do July 1st. Young adults, small businesses, Medicare recipients. You can benefit soon, and July 1st is the date. And here to talk about what is going to happen at that point is healthcare reform, insurance broker Craig Gussin. Good morning.
Good morning, Dan.
How are you?
I'm doing fine.
All right, so most of this stuff is not going into effect for years because we have to figure out exactly how to do it all, I think is one of the things, right?
Right.
But some of the things, July 1st, they do go into effect.
Yes. There are a couple of things that are going to affect. One is the donut hole for Medicare. If you have prescription cost above $2,830 in a calendar year, you're going to get a check that's actually going to be going out this week or next for $250 if you've already met it.
So $250.
Yeah,
it's a little bit of a rebate.
A little bit of a rebate.
But it helps people, obviously.
Exactly, it does. A couple of the other things are that if you have a child who's under 26, they can come and they got kicked off your health insurance because they graduated college or they didn't go to college or for whatever reason, they can now come back on your plan.
Whether they're students or not?
Correct. It's really interesting because here's the way it's set up. They can be living at home, they can be living away from home. They can be dependents, they can be married, they can be single. You can be married with kids. If you have a child who's married with a child, your child will be covered under you. Let's say it's your daughter, your son-in-law will be covered under his parents, and they would have to get covered for the baby. So it's pretty much anybody. The only exception is you can't have other group health insurance.
Wow.
So it's not like the dependent law that we're used to.
Yeah, that's interesting.
Right.
That is interesting.
However, because of the way the bill was written, the bill was not written very well, and because of that, insurance companies aren't allowing people to come on the plan until the group anniversary date. So if you have a group that just renewed, let's say June 1 was your anniversary, next June you'll be able to do it. Some companies are making exceptions, but that's what we're hearing. Now
so you still have to wait for the renewal date as opposed to saying, well, these new things are in effect, so I'd like to take advantage of them. They say, no, got to wait till the next opening.
Right.
Yeah.
Some have already, as of May or June, have already said, we're not going to kick you off, we're just going to leave you on. So it really depends. The other one is kids up to age 19 can get health insurance guaranteed issue. That was the way the bill was written. However, nobody wrote it properly so that the insurance companies are required by law to take the person. So if they take them, they got to cover pre-existing, but they don't have to take them.
Yeah, let's talk about pre-existing conditions because obviously this is one of the big things that insurance companies, you know, had been denying coverage to people because they had pre-existing. How does this bill deal with this beginning July 1st, or does it address it July 1st?
It does, but it doesn't. It does address it saying, okay, if you're 18 years old and you need health insurance and you have health issues and you apply and they take you, they have to cover pre-existing.
Yeah.
The key is they don't have to take it in because the way the bill was written, unfortunately, because it'd be a lot easier, you know, to do it.
So mandatory health insurance, but it is not mandatory for the companies to take you.
As of today, 2014, everything changes. Now the high-risk plan that's supposed to go into effect in, what, 10 days?
Yeah.
Most states, you can't get it up and running in 3 months. There's about 22 to 28 states that have said to the federal government, you deal with it. So they're putting it together, but they're not going to have it together for a while. Some states like California are going to have their own setup, but from what I heard as of a couple of days ago, they don't have it totally set up either. So July 1st probably isn't going to be there. We're looking at more towards the end of the year.
Is that right?
Yeah.
So this bill, all the pain we went through, it's still not complete. And so when you go to your insurance agent or whatever, there's still confusion.
There's a lot of confusion.
Yeah.
I have confusion every day. I mean, I spent a month and a half, because I have a niece who's 18, I was looking at maybe changing health insurance. Yeah. And I've talked to everybody, and there just aren't answers. And the last thing is a tax credit, which sounds like a great deal. Businesses are going to get tax credits.
Yeah.
I spent...
If they provide insurance.
Right. If you provide insurance and you're less than 25 employees. Yeah. And I spent a week and a half trying to figure out what's the credit, because you and I would assume there's a table. Yeah. And you look at the table, how much you're paying and all the ramifications. There isn't any. I finally found a site that would actually you can go to, you can plug in the numbers. But it isn't that great a deal, because if you have a business with 3 or 4 employees, and let's say you're paying the premiums $1,000 a month, I did the numbers, and this person's going to get about 20% as a tax credit.
Yeah.
And the tax credit isn't that good a deal because as an employer, if I'm paying $1,000 a month for my health insurance, I get to write off $12,000.
Right.
Now, because I'm saving $2,400 in tax credits, I only get to deduct $9,600 from the business, and the other $2,400 is a tax credit. So at the end of the day,
It's a wash.
it's a wash,
Yeah.
or maybe a couple bucks. So that's the problem with it.
All right. Craig Gussin, insurance agent. I think we all still need to do a lot of research
Yes.
before we take advantage of any of these things that are coming our way, because it sounds as if it's still a little gray areas.
It's going to be a long
A long process to get through this. All right, Craig.